Magnesium glycinate has become one of the most trusted supplements for older adults, mainly because it is gentle on the stomach and highly bioavailable. This means the body absorbs it more efficiently compared to many other forms of magnesium. Seniors often turn to this supplement to support better sleep, reduce muscle cramps, improve bone health, and ease stress or anxiety. However, the problem isn't the supplement itself. The real issue is how many people take it the wrong way. Even a high-quality supplement can become harmful or ineffective if it's taken with the wrong foods, wrong timing, or wrong combinations. Many people assume that more magnesium equals better health, but in reality, overuse or incorrect usage can cause digestive discomfort, headaches, low blood pressure, or nutrient imbalances. Seniors are especially vulnerable because their digestion, kidney function, and absorption ability naturally change with age. This makes proper dosage, timing, and pairing extremely important. Magnesium glycinate can be incredibly beneficial if used correctly, but the mistakes people make often block the absorption completely, preventing the supplement from doing its job. Some people unknowingly combine magnesium with medications that interact negatively, while others take it on a full stomach, which reduces absorption by more than half. This section sets the foundation for understanding why magnesium is important, but even more importantly, why avoiding the common mistakes is crucial for safety and effectiveness. Timing plays a major role in how effectively magnesium glycinate works inside the body. Many people simply take it whenever they remember, morning one day, night the next, and sometimes even right after a heavy meal. This inconsistency can significantly reduce its absorption and benefits. Magnesium glycinate is best taken at night because it naturally helps relax the mind and body, supports muscle recovery, and promotes deeper sleep. Seniors often struggle with sleep issues, so nighttime dosing can greatly improve sleep quality. But when magnesium is taken at the wrong time, for example, early morning on an empty stomach, it may lead to digestive discomfort for some people. Another mistake is taking magnesium too close to other supplements or medications. If taken alongside calcium, zinc, or iron, magnesium competes for absorption and becomes far less effective. This is why seniors should leave at least a 2-hour gap between magnesium and other minerals. Consistency is equally important. Taking magnesium at a different time each day confuses the body's absorption rhythm. Seniors who maintain a steady nighttime routine often report better sleep, improved digestion, and fewer cramps. Timing alone can determine whether your supplement actually works or becomes an expensive habit with no results. Most people don't realize that certain foods can completely block or reduce magnesium absorption. For example, taking magnesium glycinate with high fiber meals can limit how much magnesium the intestines absorb. Fiber is healthy, but when paired with magnesium, it can trap minerals and prevent them from fully entering the bloodstream. Likewise, foods high in phytates, such as whole grains, nuts, and seeds, can bind to magnesium and reduce its availability. Similarly, calcium-rich foods like milk, cheese, and yogurt can compete with magnesium for absorption, especially when consumed at the same time. Seniors who take magnesium with breakfast often pair it unintentionally with heavy, nutrient-dense meals that sabotage its effectiveness. Coffee and tea are also common blockers. The caffeine content can increase urine output, causing the body to flush out magnesium more quickly. Seniors who drink tea or coffee right after taking magnesium may lose most of the supplement before the body can use it. Ideally, magnesium glycinate should be taken 1 to 2 hours after eating or right before bed, which helps maximize absorption. Avoid pairing it with high fiber meals, dairy products, caffeine, or multivitamins. When magnesium is taken correctly, without foods that interfere, The results are dramatically better, stronger sleep, improved muscle relaxation, and better mood stability. One of the most common mistakes seniors make is taking the wrong dose of magnesium glycinate. Many assume that because magnesium is natural, taking higher doses is harmless, but that's far from the truth. The recommended daily intake for most adults over 50 ranges from 300 to 420 mg per day, depending on gender and individual health conditions. Taking too little magnesium means the body won't receive enough to correct deficiencies, leading to ongoing symptoms like muscle cramps, insomnia, fatigue, or irregular heartbeat. On the other hand, taking too much magnesium can cause diarrhea, nausea, low blood pressure, dizziness, or even heart complications in sensitive individuals. Seniors with kidney issues must be especially cautious. Another serious mistake is combining magnesium glycinate with medications that interact negatively. Seniors are more likely to be on multiple prescriptions, which creates a higher risk for interactions. Magnesium can reduce the effectiveness of certain medications by blocking their absorption or speeding up their elimination from the body. For example, magnesium should never be taken close to antibiotics like tetracyclines or quinolones because it binds to the medication and prevents the body from absorbing it. Likewise, magnesium can interfere with some blood pressure medications, muscle relaxants, and medications for thyroid disorders. Even over-the-counter drugs, such as antacids or laxatives, may contain hidden magnesium that leads to unintentional overdosing. Seniors taking heart medications, especially those for arrhythmia, must be extremely careful. Excess magnesium can alter heart rhythm. The safest way to avoid interactions is to keep at least a 3-hour gap between magnesium and any prescription medication. If a senior is unsure whether magnesium interacts with their prescription, they should consult their doctor or pharmacist. Mixing supplements and medications without professional guidance can lead to complications that outweigh the benefits. Used correctly, magnesium glycinate supports health, but used recklessly, it can interfere with essential treatments. One of the biggest misunderstandings about magnesium glycinate is expecting it to work instantly. Many seniors take the supplement for only a few days and stop because they don't see fast improvements. Magnesium is not like painkillers, it doesn't work instantly. Instead, it gradually builds up in the body. Most people who are deficient need several weeks of consistent supplementation before experiencing major changes. Symptoms like muscle cramps, sleep problems, stress, and fatigue slowly improve over time as magnesium levels stabilize. Seniors often have lower baseline magnesium because absorption decreases with age, so it may take even longer for them to feel noticeable effects. Another mistake is switching brands or forms too quickly, assuming the supplement is ineffective. Magnesium glycinate is one of the best absorbed forms, but it still requires patience and routine. Most benefits appear after 2-4 weeks of consistent use. Understanding that magnesium works slowly but steadily helps seniors stay committed long enough to experience the real benefits. Hydration is essential for proper magnesium function. Magnesium supports hundreds of biochemical processes in the body, and all of them rely on adequate hydration. Unfortunately, many seniors unintentionally drink too little water throughout the day. When water intake is low, magnesium cannot dissolve and travel through the bloodstream efficiently. This leads to poor absorption, constipation, or even headaches. Magnesium glycinate is known for being gentle on the stomach, but without enough water, it may still cause digestive discomfort in some individuals. Seniors who take magnesium, especially before bedtime, should drink a small glass of water to help the mineral absorb properly. Another overlooked issue is dehydration caused by medications like diuretics or blood pressure pills. These medications increase urination, which also flushes magnesium out of the body. Without proper hydration, the benefits of magnesium become minimal. Staying hydrated enhances magnesium's ability to relax muscles, regulate heartbeat, support nerve function, and improve sleep quality. A simple habit, drinking enough water, can make a major difference in how magnesium performs. Alcohol and caffeine both interfere with magnesium absorption. Many seniors enjoy coffee in the morning or a small drink in the evening, but combining these with magnesium causes the body to lose the mineral faster. Caffeine acts as a diuretic, increasing urination and flushing out magnesium before the body can use it. Alcohol also depletes magnesium and can worsen symptoms like muscle cramps, fatigue, and sleep disturbances, the very issues magnesium glycinate is supposed to help with. Taking magnesium too close to alcohol can also increase dizziness or drowsiness. Seniors should avoid taking magnesium within 2 hours of alcohol or caffeinated beverages to ensure proper absorption. This one simple change can significantly increase magnesium levels and maximize its calming and restorative effects. Many seniors take magnesium glycinate hoping it will solve symptoms like insomnia, fatigue, or cramps. While magnesium helps, these symptoms can sometimes be caused by underlying conditions such as thyroid disorders, anemia, vitamin D deficiency, diabetes, stress, or poor circulation. If seniors assume magnesium alone will fix everything, they may miss important warning signs. Magnesium is a supportive supplement, not a cure. Ignoring underlying health issues delays proper treatment. Seniors should monitor their symptoms closely. If symptoms persist even after consistent magnesium supplementation, a medical evaluation is necessary. Magnesium works best when paired with overall lifestyle improvements, such as better sleep routines, improved diet, mild exercise, and stress reduction. Understanding the root cause of symptoms allows magnesium to be used more effectively. Magnesium glycinate can be a powerful supplement for seniors, offering benefits such as better sleep, reduced stress, improved bone strength, and enhanced muscle function, but only when used properly. Avoiding the common mistakes discussed in this guide ensures the supplement works safely and effectively. Seniors should focus on proper timing, correct dosage, hydration, and avoiding interfering foods or medications. Keeping a consistent nightly routine maximizes magnesium's calming effects. Patience is also important. Results develop gradually over several weeks. Above all, seniors should communicate with their healthcare providers before starting magnesium, especially if they take prescription medications or have existing medical conditions. When used correctly, magnesium glycinate becomes a valuable part of a senior's health routine. It supports relaxation, improves overall well-being, and enhances quality of life, but only when taken with awareness and correct guidance.